Hi, I'm Perry Williamson. We've been serving the Dublin Lawrence community for over 90 years here at Williamson's Bakery. We specialize in donuts, cakes, pies, cupcakes, cookies, birthday cakes. They're our business, not a hobby. And don't forget our large selection of cheese straws. For special orders, contact us on Facebook, Instagram, or better yet, just come get you some. When you stop by, be sure to try our all-new Pig in the Blankets. We have bacon, sausage, and chicken. We're located at 1634 Veterans Boulevard, Dublin, Georgia. For the hot, freshest donuts, come to Williamson's Bakery. We proudly support our area athletics.
Welcome to the show. I want to say a special thank you to Dr. Dustin Gay for taking time out of your busy schedule today to spend a few minutes with us on TV 35. Dr. Gay, you guys are Houston Clinic now, and although that may still be new to a few people, a lot of people are getting used to that name and seeing and hearing you guys are doing a great job of promoting that in the community. So I want to say thank you for that. And just in case there's anybody watching the show, there could be somebody that's not quite aware of who you are and what you do here at Houston Clinic. I want you to take just a minute and tell me a little bit about you and your family and how long you've been here in Dublin, Lawrence County.
Sure. My name's Dustin Gay. So I grew up here in Lawrence County. Rachel and I, Rachel Gay is my wife. She was Rachel Kite. Moved back 6 years ago now this summer, so we've been back. I do orthopedic surgery, obviously, here in Dublin. My specialty is in knee and hip replacements, so I did a fellowship year in knee and hip replacements at a place called the Anderson Clinic, and then Rachel and I moved back. We've been here for 6 years. I have two little girls, so Sarah Beth and Eliza. They are 7 and 9 in 2nd and 4th grade. They go to Trinity Christian School, and we're just happy to be back home and back in the community, and we've really enjoyed the last 6 years of being back.
And we're so glad to have you here and fortunate to have you and the staff of doctors that you guys have here at the Houston Clinic. Real briefly, tell me a little bit more, even just everything maybe that overall what you guys take care of here at Houston Clinic.
Sure. So we really do everything now. Myself, I do a lot of knee and hip replacements, but Heath Richter, my partner, and I both do really a little bit of everything from hand surgery to knee surgery to shoulder surgery to pediatrics. We have not in the past really done much back surgery. We're really no back surgery. We've seen back pain and treated it, but haven't had the opportunity to do back surgery. We are now, as a part of the Houston Clinic, which is a bigger orthopedic practice, we will have access to some spine docs that are hopefully going to start coming down to Dublin and seeing patients here and do some surgeries over at the hospital. So that'll give us another ability to take care of the community that we didn't have before. Other things that are maybe more complex hand surgery that Heath and I didn't do, we also will have access to some hand specialists to do that stuff that's out of the scope of what we were typically doing just as the two of us ourselves. So we are still here in Dublin. We're still seeing patients in our same office building, and we'll still be operating here at Fairview. So it really doesn't change a lot for the people in the community other than some access to different services that we didn't have before and a different name on the sign.
Okay, and I think it sounds so funny to me, by the way, when you say Heath and I are doing these things. I wish I was a doctor. But you guys, I think we talked about on a previous show, mainly the things and some of the changes would be a little bit more internal with some benefits and different things that you can offer for employment.
Yeah, some of the changes when we swapped over from our previous model, we have our same employee. We pretty much kept most of all of our staff. You know, they have benefits and things that we think are important. They have 401ks and a nice HR department and health benefits and things. So being a part of a bigger system like Houston Clinic allows us to provide those services for our employees, which is a benefit to them and to the community. So we're happy to do that. We're happy that Houston was willing to partner with us and allow us to do those things, but still be here in Dublin, still take care of the local community, but be involved with a bigger company and a bigger practice that allows us to have benefits for our employees.
So same quality care that folks are used to when they come see you guys.
Yeah, we sure hope so. Heath and I haven't changed any, so we hope we're still taking care of patients the same way. So nothing really changed for our patients other than a little bit of a headache of filling out some paperwork when they come in to see us, because they're all like new patients when they come in because of our new computer system and things. But nothing different about the way we take care of people.
Fantastic. Well, again, congratulations, and we are happy that you guys are partnering with Houston Clinic, that they're here in Dublin, Lawrence County, and having a great impact. So we're going to take a quick commercial break, and when we come back, we're going to talk about some of the things that you guys are involved in here in Dublin, Lawrence County. We'll be right back.
Imagine a life-changing injury. Imagine the fear and unknown. The Houston Clinic Sports Medicine Team, the only physicians in the area with advanced certification in orthopedic sports medicine, treats sports injuries with innovative techniques. The Houston Clinic has helped nearly 1 million athletes live without pain. Imagine getting back in the game. Imagine the best game of your life. The Houston Clinic Sports Medicine Team.
Welcome back to the show. Again, Dr. Gay, thank you for taking time out and sharing with us a little bit about Houston Clinic and what you and the other surgeons and folks, doctors, do here at the Houston Clinic. One thing I alluded to before the commercial break is you guys are heavily involved in the community here. And something that's very important to folks in Dublin and Lawrence County is football on Friday nights. Talk a little bit about your involvement there.
Sure. Heath and I have been taking care of the high school football players and cheerleaders and everybody else for really about 10 years now. I think Heath has been here close to that. But we love to go out to the games on Friday nights. We try to have either ourselves or one of our PAs at all the home football games for the local teams. We have trainers helping us and helping some of the therapy folks around cover those games as well. So we try to be on the sidelines, there to take care of the kids when they get hurt, and then we try to see them that following week if they need to, get them in on Monday. We really enjoy that. We enjoy the involvement with the community and helping the schools take care of the kids, doing things like physicals for the kids out at the schools prior so they can play, and then taking care of them afterwards. So we really enjoy that involvement. It's why we do what we do, so we're glad to be there on Friday nights.
Well, again, and we're blessed to have you guys. Something, and I know you're not going to mention it, but I want our viewers to know these guys do these games on Friday nights free of charge. You're taking time away sometimes from your family and different places that you could be and doing things. But again, I think it's the passion that you guys share for what you do. So we certainly appreciate you being there to take care of our athletes and our cheerleaders. Dr. Gay, tell me a little bit, what types of injuries do you typically see when you're at these games?
Yeah, we see a lot of knee and shoulder injuries with the football game. So sometimes clavicle fractures or what we call a shoulder separation. We'll see shoulder dislocations, occasionally fractures in the upper extremity, and then a lot of knee injuries. So twisting injuries to the knee, ACL injuries, MCL injuries, occasionally some concussions. We see that both on the football players as well as the cheerleaders. So those are most of the things we take care of. Also, we'll see occasionally, I had a kid last year dislocated a finger while playing on the offensive line, and we popped that back in on the sideline, and he got to go right back to playing. So, you know, it can be entertaining at times, and other times we're just there enjoying a football game. So
share with me, and for our young athletes, and then even for our folks that maybe we've passed our prime years of playing softball and baseball and things, but maybe some preventative things we can do that could possibly keep us from having some of these injuries.
Sure. We tell the kids this, and it still applies to me and you, who I'm past my playing prime too. So hydration. So we really stress to the kids, especially with it being as hot as it is outside and humid, that you really hydrate well. You make sure you're paying attention to how hot you're getting. So heat strokes and heat injury is a real problem in the state of Georgia. So the coaches follow that closely. But as we get older, we don't think about that, and we can get overheated and really have injuries related to that. So that's important. And then I think stretching. You know, a lot of times we want to get out and play these games or go play a pickup softball game, and we forget that we need to warm up a little bit, I think, get the muscles warm, and then really stretch. And that prevents a lot of the muscle injuries and things that we see, especially in the slightly older population, as we try to get back out there for one more game. So
I think I can certainly attest to that, and I've had some back issues lately with jumping out of the car and maybe running to the tee box. I want to ask you something, and if you can share with me, this is strictly just your opinion, although it is a professional opinion, but children today playing sports and playing sports year-round. Talk about that.
Sure. I see a good bit of that. There's a lot of, obviously, travel sporting teams now that weren't around when I was growing up. So when I grew up, we may play 3 or 4 different sports and do what we call cross-training. So you get different experiences to different sports and use different muscles. Well, most of the time now, kids are picking one sport very early, and they play that sport almost year-round. So that leads to issues that we didn't see in kids before. So you have these overuse issues, and especially in elbows and pitching athletes, we see a lot of. So we really try to stress the importance of playing other sports, doing other activities, really taking a break from the sport for a while for kids. Even though they're young and they don't really complain of a lot of pain, they can have injuries that can be very serious and very bad and lead to surgery if they don't take breaks and do different things. So I think it's important for kids to be well-rounded and to experience other sports and maybe take a break, not play baseball or softball or any sport really year-round all the time. We see a lot of injuries now in kids that we used to only see in professional athletes because of the amount of time they spend playing these sports. So I encourage parents to give kids breaks, to let them play different sports. If they really are in love with one sport, to really make them take a break 3 or 4 months out of the year and not do that sport. And I think that's important and will prevent injuries that we're seeing.
I couldn't agree with you more. I know we've got some folks maybe watching the show that might disagree with us, and that's okay. Everyone has their children, and you raise your children the way you choose to. But I appreciate that, and I would agree with that as well. So with these injuries and things that are happening here, I know you guys have. We mentioned we see different types of incidences and injuries. You guys also have different ways now that you address those things and then follow up. So tell me a little bit about maybe a typical injury and then what the procedure and process and follow-up looks like.
Yeah, so if talking about sports or really any injury, we see the patient or the kid initially, and normally that involves an x-ray a lot of times for us, and then a clinical evaluation and exam of the patient and determine what's wrong with them. Once we understand what's going on, then we can treat them. A lot of these injuries can be treated without surgery, and most of the patients we see aren't going to the operating room. Most of them we treat. It generally then will involve either some type of medication, maybe injections, or maybe just physical therapy. But a lot of times physical therapy is involved. And we had a lot of great therapists here in the community that really help us take care of these kids and athletes as well as older adults. We'll generally go through physical therapy, and then we will see them back after whatever treatment we decided they needed. Follow them up, make sure that they're improving, and a lot of times get them back to life or sports without any further treatment needed. There are those patients, and a lot of my patients older with things like knee arthritis, that maybe I can't get better with that we then end up doing things like surgery on. But surgery is really a last resort. We treat most of the people we see with medications and therapy and injections and modification of their activities and what they're doing, and get them back to life without pain. So
I think that's great. Dr. Gay, if someone, let's just say out playing golf on the weekend or at the game on Friday night, and maybe they get up on Saturday and they just know something's not right, do they come directly here to Houston Clinic? Do they go to a primary care physician? How does that work?
Yeah, a lot of that gets confusing in that we like to see people right after their injury, and certainly if they call the office, we try to make an appointment and get them in and evaluate them. There are some insurances, though, however, that require a patient to be referred by their primary care provider, and that's strictly dependent on their insurance policy and how it works, that they can't see a specialist without being seen by their medical doctor. So occasionally patients will call the office and we want to give them an appointment, but we tell them, you got to have a referral from your primary care doctor. That's not really related to us or our policies. It's to keep them from having to pay to see me out of their own pocket. So it's often kind of confuses patients, and they don't understand, and they think maybe we don't want to see them, which is not true. But some insurance policies and providers just require that they see their medical doc, have it evaluated, and then be referred to us to see them. But we'll try to help them with that. The local medical docs are great about either getting those people in and sending us referrals so we can treat them, or sending us a referral if they know the patient, know them well, and they know it's an orthopedic injury. So it tends to work out well, but I like for people to understand that we want to see them. We love to see them right away, so we will if we can without a referral. If we need a referral, we'll try to facilitate them getting that. So.
And Dr. Gay, I think you mentioned earlier in the show the fact that you guys, even though you do what you do here and you do it great, you guys have a lot of community partners. So we really appreciate, even at the Chamber, you guys support the Chamber. You support our functions and events and golf tournaments and things that we do. But talk a little bit maybe about that collaboration and how you guys do work so well with others.
Oh, sure, yeah. We couldn't do what we do without the rest of the medical community and just the business community around. So, you know, we mentioned the physical therapists that are so important to us that are out in the community. Those are very important. The medical doctors really, I mean, gosh, we couldn't do what we do without them. They take care of the patient's medical issues. If it's somebody that does need surgery, they get them ready, they get them prepared, they get them cleared. And we have a really good relationship, I think, with the primary care doctors in the community. We're able to call and talk to them and communicate with them about patients. And there's rarely a clinic day that goes by that I don't speak to another medical doctor or oncologist, one of the other folks in the medical community about the patients. So also the hospital and the services that they provide and the imaging centers that we have around to do MRIs and those kind of things, we couldn't do what we do without those people. So having a community of businesses and a medical community is the only way we can do what we do to take care of patients. So you may see my face or Dr. Richters' face as the person that's taking care of the patient, but there's a lot of other people in the background that make that possible. So.
And I think that's absolutely important. Dr. Gay, we talked a lot today about sports and things such as that. These guys are great teammates for our community, our young folks, our older folks that may still be involved in some sort of athletic participation. But again, great teammates. Dr. Gay here at Houston Clinic. We're going to take one more commercial break and we'll be right back.
Hi, I'm Chuck Harwell, President and CEO of the Community Bank of Dublin-Lawrence County. I would like to personally invite you to come in and open an account with us. Our service and lending professionals know what it takes to make life easy and convenient and will help you get set up with our mobile and online banking right away. We founded Community Bank on common sense banking and a dedication to help people just like you with your personal or business accounts. We want to assist you in securing loans for your automobile, home, land, or whatever financial goals you may have in life. We founded Community Bank on common sense banking and a dedication to help people just like you with your personal or business accounts. Visit us at Community Bank of Dublin-Lawrence County and come in and see why common sense banking never goes out of style.
Welcome back to the show again. It's always a pleasure to spend time with a fellow golfer and an athlete. And so I know you understand the pain and the injuries and things that we go through. Dr. Gay, we were talking before break about community partnerships and teammates and all the things that you guys do here at Houston Clinic. Something else that you guys do sometimes monthly are some sessions for folks to come in and learn about different types of ailments or treatments, or I'll let you talk about that a little. You'll know more about it than I do.
Sure. Yeah, we have done, since I've been back really, community talks. We think it's important to educate people in the community about what we do, but about the problems that they have. So I spend a lot of time talking about knee and hip replacements. That's a lot of what I do. That's my passion. So I see a lot of the older patient population and take care of those sort of chronic issues, and people like me and you are getting further out from our sports career, and now our knee or our hip are hurt. So I go out and do educational talks through the hospital and sort of lunch and learn type things, or after hour community talks. We spend some time going to the local clubs, the different exchange clubs and those kind of things, and talking about arthritis and how we treat it, and really just trying to educate the community about what it is and why they hurt the way they do and what the options are. And to not be afraid to come see us and talk to us. A lot of times people think, well, that's a surgeon. If I go see them, they're going to cut on me. and they're not just ready for that. And I understand that, but we try to educate them on we have lots of ways of treating your problems, surgery being the last resort. We try to do other things like medications and injections and keep people active and keep them going. So we want people to feel comfortable coming to see us and talking about those things. And so I think those community talks are important for educational purposes.
And I think it is sometimes for patients, and just so people do understand, you guys aren't, standing there with a knife and just ready to cut anytime someone comes to see you. If you can, you do want to prevent and use that as a last measure. But let's use that scenario and say, okay, you do have to have surgery. Let's talk about today's hip or knee replacement and how it might look versus maybe even 10 or 12 years ago.
Sure, yeah, I think knee and hip replacement has evolved a lot. The implants we use are very good now. The length of time that they last are a lot longer. So people used to have more concerns about, well, I'm going to get my knee replaced or my hip replaced in 5 years, 10 years, I'm going to have that redone. Well, now we're really seeing knee replacements because of technology and the way we make them lasting 20 plus years. So we can get people a lot longer time of being active on their knee or hip with pain relief than we could before. So that's been a big change. And I think personally the biggest change in knee and hip replacements has been our ability to control and treat people's pain. So it's a different procedure than it was 15, 20, 25 years ago, where people would hurt really bad. We'd put them in bed and leave them there for a week after surgery. We didn't let them move. That's just not the way it works these days. We do more regional anesthesia, which is like numbing shots, numbing people's legs up to do their hip and their knee replacement. We don't have to give them a lot of medications that confuse them and make them sick. So we get them up and we move them the day of surgery. I have knee and hip replacements walk the day of surgery. They do physical therapy the day of surgery, and then they go home the following day. So these people are spending 24 hours sometimes or less in the hospital. Then they're out, they're back in their home, they're up standing walking, they have physical therapy coming to see them. So it's a much more outpatient, much more patient involved, much more pain control procedure than I think it was 20, 25 years ago.
Okay. And I don't know if we can do this quickly and in simple enough terms for someone like myself, but could you walk me through really quick maybe what the process, if I'm having my hip or my knee replaced, exactly how does that work? What are you doing there?
Yeah, so the procedure itself is knee and hip replacements is more of a resurfacing procedure. So it's the arthritis is when the joint wears out, the cartilage, which is the padding, is gone, the bones rub together, and it hurts. The fix for that is to replace that cartilage that's missing. We do that in a knee replacement and a hip replacement using a few metal pieces I won't get into the details of, and then a bearing, a plastic bearing or polyethylene, which becomes cartilage in the knee or hip. And we're able to put those pieces in and stop the bones from rubbing together, thus getting rid of people's pain and allowing them to be active. And again, we talked a little bit about the length of time in the hospital. The surgery itself takes usually about an hour to an hour and a half, so not a real long procedure, whether it be a hip or a knee. And then people are right back to being active. And I think that the surgery scares people. I get that. It is real surgery. It is big surgery. But we're able to do it in a very controlled fashion and get people back moving very quickly. And it tends to make people very happy in the long run.
And I think I would know the answer, but I want to make sure, and I think it would certainly lead toward later years, but there's no age as to where you would or would not have one of these types of surgeries?
That's right. We like people to be older rather than younger when we do it because we want the joint replacement to hopefully last them their lifetime. But for me, it's really about quality of life. So when people are being prohibited from being active and doing activities that they want to do by knee or hip arthritis, and I can't control it with any other method, meaning I've tried medications, I've tried injections, we've done therapy, and they're miserable and they can't do the things that they want to do, then I think quality of life becomes the choice. And we replace their joint. We have the ability to redo joint replacements now if we need to. So if you wear it out, you get it young, you wear it out, we can redo it. I certainly don't advocate doing it really young, but if I've got a patient I just can't control and I can't get them active otherwise, I think giving them mobility and quality of life is more important than worrying about them having their knee or hip replacement at a really young age.
Absolutely. Dr. Gay, again, I appreciate you being on the show today. If you would, I want you to take just a minute and look into the camera there and just share a message with our viewers about Houston Clinic and the services that you provide here.
Sure. We just want to thank the community for supporting our practice. We want to tell everyone that we are certainly now the Houston Clinic, still the same doctors in the same place, doing the same procedures at the same hospital. But we want to continue to be a part of the community, and we really want to take care of patients in a quality way. So give us a call. Come by and see us. I will put this out there. We've had a little bit of issue with our phone system getting up and running in our new practice, so please forgive us if there's been any problems with that for you, but please give us a call. We'd love to take care of you.
Dr. Dustin Gay, one more time, Houston Clinic. Come see these guys. They are certainly help us make sure that today and every day is a great day for business in Dublin, Lawrence County.